So I just have to start by adding my own words of thanks, and not only, as Larry pointed out, to all of you for making this possible, but frankly, to everybody for making today specifically possible. The disruption of the hurricane, the fact that we had to, at the last minute, cancel, and that so many of you are here today is really testimony to everybody's dedication and I think love for the programs and the work that we do. Now, as I was coming here today, what I kept thinking about is something that we heard over and over again, and Evelyn always said it, which is that knowledge is power. And that's really what we're here to do. The reason that we enjoy this symposium so much, among many others, is that it's an opportunity to give back and to share the knowledge. And if you can leave every time we meet with a little more understanding and insight into the problems of cancer and breast cancer in particular, and the ways in which we're trying to tackle them so that we can all be partners in actually taking on the larger issues that confront us, then we've all done our job, and you will be, I think, empowered to help with the cause. So we'll do our best to share. Along the way, you'll have an opportunity today to ask questions, and that's always something, by the way, that we find invigorating and exciting, so don't hold back. And there are no dumb questions, there are no bad ones. The only thing we don't do is consultations from the stage. Apart from that, third person, it's all fine. So I'm going to just very quickly introduce our panelists, and then we're going to circle back, and you're going to have an opportunity to hear about each one of their projects and areas of interest. So first is, on my immediate left is Joseba Salga. He has had a long and impressive career starting in the lab at Memorial Sloan-Kettering, where he worked initially on antibody therapy for cancer. You'll hear a lot more about this as we go along. But now he's returning to New York to be physician-in-chief at Memorial Sloan-Kettering from MGH, and before that, Vall d'Hebron in Spain. And he is a past president of ESMO, as well as a world-recognized leader in many of the most pertinent areas of breast cancer and cancer development in general. So welcome, Jose. And then beside him is somebody I know that many of you know, Gabe Portabaji, and he is a professor of medicine and past chairman of the Department of Breast Medical Oncology and the Nellie B. Connolly Chair in Breast Cancer at the University of Texas MD Anderson Cancer Center, where he was also the director of their famous multidisciplinary breast cancer program. And again, it's a thrill to have him here, and particularly to point out that he's this year's Jill Rose Award winner. So we'll be hearing more about that a little later. And to his left is Kathy Miller. She is Associate Professor and Sheila D. Ward Scholar at the Indiana University School of Medicine in their Division of Hematology Oncology. She is a leader in ASCO, having held many important roles. That's the American Society of Clinical Oncology there. And she is actually one of the pioneers in the development of anti-angiogenesis therapy in the clinic. And you'll hear more about that, I think. Welcome, Kathy. And finally is Jed Wallchuck. He's Associate Attending Physician, again at Memorial Sloan-Kettering Cancer Center, Associate Director of MSKCC's Ludwig Center for Cancer Immunotherapy, and the Director of our Immunotherapy Clinical Trial Center. As you'll hear, his specific area of interest is immunotherapy, and it has emerged first, I think, in melanoma. But I wanted to make an immediate point about this, which is that this speaks to the cross-disease, multidisciplinary nature of a lot of the research that you'll hear about, and I think it helps understand the broad benefits of the kind of work that we aim to do. So, Jed, welcome. Now, for those of you who've been here before, and I think that's probably most of you, I want to make one more brief introductory comment. Normally, the whole front of the room is filled with our investigators, but given the rescheduling, I just want to acknowledge that while they all asked about coming, we were honest with them that they had already, in many cases, sacrificed days of their planned work lives the first time around, and I know that what you want them doing is the research that we're all funding, and so some of them, mostly who are geographically nearby, are here today to help support our effort today. But that's the reason for not seeing all 100 and 97 of our funded investigators here filling the front. Now, the good news is it means all of you are closer. So, but at the same time, I want to point out that as we go through the panel, it's very likely that some of the people who are here have really important additional contributions to make to the discussion, and we will call on them either because we know they can answer it or because they wave at us and tell us that they want to. So, sitting in the back, Andy, is not going to get you out of answering a question. All right. Now, the way we like to do this is, without slides, we will ask each one of the panelists to make a short presentation on their area of funded research so that you can understand how they're translating your support into advances in the care of and treatment of people with cancer. I do want to point out, and I always acknowledge this at our panels, that this is much harder than it may seem because, everybody on the panel is used to speaking with slides. And the slides, in contrast to what you may think, aren't really there to entertain you. They're there to keep the panelists organized and on point. So now they have to do it in their heads. And the second thing is no jargon. So you'll see that on occasion we'll interrupt them if they slip into any medical jargon. So with that as an introduction, we'll start with Gabe. He's used to doing this. And he can talk a little bit about his work, remembering that today's theme is really, again, magic wands, making cancer disappear through progress. So Gabe.